Thanks for this interview opportunity. My goal is to let you know that I am the best candidate for this job. I'm Candy Hughley, and I've lived in Knoxville for 20 years. I feel my experience gives me the competency and knowledge to be an excellent candidate for this position. Community health has always been my passion. I've been a registered nurse for over 25 years. I'm in school now to obtain my bachelor's degree, and my primary goal for this additional education is to shift my nursing role into this area. Community health is important to me because it deals with promotion of health issues and prevention of illness. I was very fortunate to have community health nursing as one of my first semester courses. These clinical experiences are what gave me the broad horizon of Knoxville's community service. There are many services available in Knoxville. My mission will be to grow these services utilizing resources to the maximum for health promotion and maintenance. I will propose to you ways I can accomplish this with prevention of illness being the key. I participated in a health fair held at a job location and feel like this was a very beneficial thing to provide their employees. I want more of these in action. This will require limited funding, as most of the providers of the health fair are marketing their products as volunteers. It gives employees a chance to have a health assessment and evaluation. We will approach employers with this opportunity and explain the benefits. We will then acquire a database of service providers willing to participate in these health fairs. Smoking cessation information booths, along with booths that measure body mass index and glucose monitorings, are events I would like represented at every health fair. I'll also be sure to have booths regarding physical activity opportunities at every fair. Tennessee is ranked 42nd in the national health rankings. In the past 10 years, obesity has increased from 22.9% to 31.7% of adults, with 2 million obese adults in the state alone. So changing Knoxville alone can make a difference in these statistics, and my goal will be to start here in the workforce. Health fairs provide a simple, coordinated way to implement health risk assessments, educate employees about healthy living practices, and demonstrate an employer's commitment to health and well-being. Medical insurance, as supplemented by most employers, will show a decrease in claims. Most employees will lose weight and stop smoking, which in turn makes them a more productive employee. Knoxville's Lost Sheep Ministry is an area I will expand. The mobile dental service was very impressive to me. I witnessed tooth extractions and routine dental care for the underprivileged. Dr. O'Rourke and team perform these services free of charge. My goal is to enlist physicians and nurses to volunteer for a similar service with a mobile medical trailer. This will, of course, have the cost of providing the trailer and equipment, but with volunteer services, it will be cost effective with the promotion of health care and prevention of illness. When I served as a student at this organization, there were regular patrons that had their blood pressure cards to record their weekly fluctuations along with weekly glucose monitoring. Many were hypertensive and hyperglycemic, and they never received medical care. My goal is to at least have monthly access with a medical doctor or nurse practitioner that can provide these patients with needed care. Certainly the homeless population cannot afford medication, so I plan to lobby pharmaceutical companies and representatives to get sample packets of medication for treatment of diseases such as hypertension and diabetes, and have these ready to dispense by the physician or nurse practitioner on a monthly basis. We will get to experience positive feedback as we get to see their conditions improve with weekly follow-ups at the medical team. There will be a reduction in the amount of homeless people needing emergency medical intervention for these illnesses with our medical management. There are many opportunities in this town for fitness promotion. The Knoxville Track Club offers many levels of fitness participation. Fleet Feet Sports and Runners Market offer programs as well. Although effective, each of these require a membership or fees. My goal is to implement a Let's Move Knoxville theme to welcome all fitness levels. We will advertise this to promote attendance to walk or run in weekly events of varying distances hosted by our town that we will hold at multiple popular community areas with a volunteer leader at each location. We will pair each person with a buddy to enhance participation and accountability. Motivation will come to the participants as they begin to see results in their health. We will challenge all participants to participate in a Knoxville Marathon event, which has 3.1, 13.1, and 26.2 mile options, and offer a discounted fee. We have great greenway resources that can be utilized for this cause. Parks and recreation establishment in Knoxville is well above the average town. My role here will be to maintain what has already been accomplished and utilize these greenways to the maximum benefit of our town. We'll see a rise in fitness levels in Knoxville as we have hundreds of people join the Let's Move Knoxville team and encourage them to log weekly mileage with the goal of being over 25 miles per week. By reaching out to just 10 additional people per week through advertisement or word of mouth, we could have over 500 members in a year. My vision for Knoxville is to have a healthier community. Promotion of exercise for obesity prevention and diabetes management will be important. I would like for the homeless to have access to routine medical follow-ups and prevent hospitalizations through prophylactic measures. This will be reflected in decreased medical needs for our population along with decreased hospital admission. Finally, my management style is important in your decision because you will hire the most qualified applicant. I have compassion and I lead by example. I will manage finances and implement and follow a budget. My primary focus will be leadership. I assure you that every person I attain and hire will be respected and be a part of the team I build. Leadership is essential. Most of the programs I suggest requires volunteer services. I'm a strong candidate for this position because I will recruit these volunteers and keep costs to a minimum. I'm a people person and I will require that same approach from my team. Thank you for your time.